Welcome to the video version of the entry point of energy assessment and treatment. Now, entry point of energy, of course, as we learned in lecture, it demonstrates how we recognize and process how the body absorbs energy coming in from the ground reaction forces. Every step we take, we absorb energy into the system. When there's an injury, when there's a problem, when there's a change in gait, i.e. limping, the energy gets absorbed into the system differently. And in fact, when we limp, the energy gets absorbed into the system the same way every step we take. We limp the same way every time we take a step. We want to change that. What I'm going to demonstrate here with our patient is go through the EXSTORE assessment lower extremity scan, find what the inhibitions are, and then we're going to see if there is any disruption of the accessory movements in the foot and the ankle. And then we're going to correct them and then retest to see how it's affected and made functional change. All right, great. So we're going to start off going through a quick EXSTORE assessment. I push down, you push up. Go ahead, push up. Good. All right, let's have you lay on your back. So here we found the iliopsoas was inhibited on the left, the TFL was inhibited on the left, and the gluteus medius all inhibited on the left. All are either hip flexors or abductors. They all stabilize the knee. They all play a role in back pain and, of course, stability of the pelvic girdle. What we're going to do now is assess accessory movement. When I release restrictions in the foot, I like to cover 3 zones. Of course, there's the zone that you find to be restricted, but as a rule, I go between the 2nd and 3rd digit, and I come down mid-foot. So I'm in between the 2nd and 3rd cuneiforms. I draw a circle there. I go to the sinus tarsi, the depression, GB40. I draw a circle there. And then the talar dome, I draw a circle there. I clear those areas with my hands, and then any additional point where I really feel the restriction. In my case, I found it here. So I'm going to do that as well. This is better. So after I do this, we want to now input energy into the system because we want the body absorbing energy correctly. So I have the patient pop up and walk back and forth just a couple of times, just so we can stimulate the area and reset the system. Reset the way the muscles absorb, the joints absorb the forces and the inhibited muscles behave. Okay, so I'll have you lay on your back. I'm going to go through the EXSTORE scan once again. Same thing now, this is the gluteus medius. Go ahead, push out. Push out that way. Push, push, push hard, hard, hard. And you can see how much better that is. And all we did was we improved the way energy enters the system. So this is a great place to start. When you have a patient with a lot of problems, you have patients that are maybe apprehensive about acupuncture needles. You have athletes, of course. After we correct the inhibitions, we want to fix this. After we correct the inhibitions, we need to fix this because otherwise they're going to be absorbing forces the same way. Not exactly the same way, but we clear this, we give them a fresh platform in order to interact with the environment. Any questions, email me at exstore@usa.com.